We talked about it, and with the amount of brain shift and how things look, everybody agreed that we should probably go ahead and try to take it out. Downside, of course, like I said, there's a low probability that we're going to get the targeted 90%. So, neuroradiology looked at the distance, my colleagues looked at the distance. We're going to try to take it all out if we can, but
If you take a little bit more than you have to, what am I gonna lose?
so one of the things that I was thinking about as part of the reason that I would like a biopsy is that I kind of want to send you for a functional MRI, but I might try to get that scheduled anyway. And I think the majority of your primary control is going to be on the left side of the brain, but we never know for sure. So the functional MRI is going to be an MRI where you're talking, you're awake, and they're going to scan your brain and see how active it is and what areas are active while you're talking and thinking and recalling things. It's possible that that my resection is going to be limited because there's going to be memory areas or control areas there. So, but I won't know until the functional MRI. I'm pretty sure you're going to have what's called a pie in the sky visual field cut. So part of your vision is going to be cut out. So right side temporal lobe, it's going to be in both eyes, the left upper corner of your vision. You're not going to be able to see, but you won't notice it.
Okay.
Usually whenever you have a visual field cut like that, typically somebody will say they keep running into a door or something like that, but that's with the entire half of their vision cut out. Had a pilot who came in just because he normally always sees the tower when he lands, and he didn't see the tower, so he decided to go get his eyes checked, and he had a field cut. So you probably won't notice it.
Okay.
And typically a pie in the sky cut is not a big deal. Now there are some vital structures very close. The middle cerebral artery is right there, which supplies half the brain with blood.
Okay.
The cerebral peduncles are right there,
What's that?
and that controls all the motor function. It's a pathway within the brainstem. There are two sides, so as the cortex comes down, they go into the brainstem on both sides. The tumor is squishing one side, so as I take it off, if I go too far, I can damage that permanently, and injury to that is a permanent deficit. There's no recovery from that. Of course, the blood supply to the brainstem is right there. Loss of the blood supply to the brainstem could be terminal. So it's a very dangerous surgery.
She has a choice.
Do I have to be awake or
Asleep.
asleep? Okay.
I think in this area it's going to be asleep.
What happens if she doesn't have any surgery?
If you don't have any surgery, like I said, normally the average survival, maximum medical therapy with radiation and medication, chemotherapy, average survival is 3 to 6 months. We would use supplemental devices such as Optune, which is, it creates an electric field around the brain, and that decreases the splitting of the cells. That might buy you an extra month or two. Now, I will say this. I have one patient who I did a needle biopsy a few years ago or a couple years ago, and they way surpassed the expected survival. So, but that's with medical management. Now that person is starting to grow new tumor very rapidly, So, unfortunately, with these kind of tumors, it's an eventuality. Given the location of where the tumor is pushing on the brain, it's possible that it's going to close off the drainage outflow to the cerebrospinal fluid. Cerebrospinal fluid is produced in the middle of the brain. It circulates, well, it's produced on each side, circulates to the middle, flows to the back of the brain, and circulates back up where it gets reabsorbed. Keeps the brain and the spinal cord floating, so if you were to fall, hit your head, the brain is cushioned in the fluid. Exactly. Now that fluid goes through a very small, sort of pinhole almost area.
And it regenerates, or it reproduces
About 12 ounces.
about 12 ounces a day.
And I have to
Body
think about the
reproduces.
conversion, but it's about 450 milliliters a day. So, as that slowly gets blocked off, you'll get some headaches, then you'll start to fall asleep, and then you won't wake up. Your breathing will eventually slow, and you'll just fall asleep and pass that way.
So what's your recommendations,
Well,
based on everything you know?
based on what you told me earlier, my recommendation would be a full surgery. We'll try to go in, resect as much as we can.
Kids,
What do you want to do, Mom?
I wanna fucking live.
So if your best chance to live is the surgery, then that's what we're gonna do.
It's time to actually be stubborn right now.
Yep.
Fight.
It's time to be stubborn now?
Yeah.
I mean, I can't be
My
stubborn.
other question is, since
this
that
again?
left side controls so much, and you said it just hit her vision, but there's a lot that the left side does.
Well, the tumor's on the right side.
I'm sorry. So left side deficits though.
Correct.
Yeah. So, do you think it'd be a flaccid side at all with that left side?
It's possible. Yeah, we don't know yet.
Is it growing since she's been here? Has it grown?
It's continuously growing. It probably hasn't grown noticeably.
Okay.
If we were to get another scan right now, I would say you give it about 2 weeks, you'll notice something.
Can the kids get together and talk
Absolutely.
before?
Yeah. So I'm gonna talk to the operating room and
Yes.
see if they can put you on the schedule for Friday.
Okay.
But I would like Dr. Akbeek. He's one of our complex spine specialists that we operate on a lot of these kind of tumors together. And we did almost an exact surgery to this on a lower grade tumor many years ago. And I would like his involvement. So he's just going to be my assistant. I'm your only neurosurgeon. So we'll start later in the day. Okay?
Okay.
If we do it.
Yeah.
There's also Saturday, which I would advise against. So, even though it's going to be a little bit late on Friday if we do it.
Okay.
You guys okay with Friday?
Yes.
So you for sure made up your mind this is what you want to do?
Yeah, I wanna live.
I also
I
I
got
spoke.
mean, we
grandbabies,
know
I-
that this is not a guarantee though.
Nothing's a guarantee
Well,
in
I'm
life.
just saying, because you just told you all the major risks
Yeah,
if they go in
that's
there.
some risk involved, but
3 to 6 months could change into a couple of years.
Possibly.
Yes.
We've actually, a lot of tumors that I've done exactly the same tumor in more eloquent areas or more dangerous areas. I've had survival between 20 and 22 months. The one difficulty is just how much of that we can get out without causing you significant harm. And if we can get the 90%, then we can change survival, or at least that's what the statistics show.
I got grandkids, gonna have grandkids. I wanna see that.
That's what you want, then. We're behind you, whatever you wanna do.
You know,
Schedule it.
Okay. I have to go talk to somebody else,
okay,
and I'll go down to the OR and then see if they can. They actually had already reserved me time on Friday for another case that was being added on.
Okay.
And then they canceled it, so. In anticipation that this case is gonna need to go, cause this is more urgent than the other one. Okay.
Thank you.
Okay.
For making it urgent.
Yeah, we don't want that thing growing too much longer, so.
Thank you.
so,
Okay.
Yes.
Thank you for explaining everything.
Yeah,
Yes.
absolutely. Okay.
this is my sister-in-law, my brother, 2 of my granddaughters, my oldest daughter,
Lots of family.
my 2 oldest sons, my youngest son, his girlfriend, and my youngest daughter,
That's not ours.
and my niece.
Oh, sorry, excuse me. Okay. Well, you guys talk amongst yourself, and, yeah, I'll go ahead and put you on. So even if you change your mind later, that's okay too, okay? But,
I say we do it,
Okay.
I'd fight like hell.
yeah. I wanna fight.
okay, I will see you tomorrow morning, okay?
Thank you, Dr.
Okay.
Yang.
Yep, absolutely, okay.
Thank you.
I talked to